The harsh reality is that among people who are in poverty, there's more obesity than underweight. So the major health issue that has to do with nutrition is overnutrition. If you're getting the wrong food.
Welcome to the Express Soul Health and Wellness Podcast. In each episode, you'll learn from experts about the best practices and technologies to live a happier, healthier, and hopefully a longer life. Here is your host, Claudia Erdenola.
Hello, my name is Claudia Urdinola. Welcome to Express Soul Health and Wellness Podcast. Here at my podcast, we talk everything about better ways in how we can take control of our health and regain the vitality to live longer, healthier, and happier lives. So if this is a subject of your interest, please subscribe right here and hit the notification button. Also, follow us in all our social media channels. We really appreciate it. As I've been talking to you in my podcast for the last couple weeks, I went to an event with my husband called Low Carb for Better Health. And my espresso coffee and my podcast sponsored the event. And at the event, we had the opportunity to meet with amazing speakers, doctors, and experts into the health community talking about the keto diets and carnivore diets. I was had the opportunity to talk to Dr. Ken Berry, Nisha Berry, Craig Emmerich, Autumn Weathers, Jennifer Williams, and Dr. Eric Westman. And Dr. Eric Westman is the person that I want to introduce to you right now. He, if you don't know him, I highly invite you to go and his YouTube channel. He's a very popular doctor into the keto community because he has been an expert into the control of obesity, reversing diabetes and metabolic diseases through the ketogenic diets. Dr. Weissman comes from very, very long time studies and experience in dealing with patients into these low carb diets. And he got, he studied with Dr. Atkins back in the day with the Atkins diet and evolving into these ketogenic diets that we have available today. If is there a doctor that has been like the OG, so to speak, in all of this movement for the low carb, ways of eating, is Dr. Eric Westman. He's also a professor at Duke University of North Carolina. So I think this is that kind of person that needs very little introduction. I really want you guys to listen at my short conversation with him. This was a talk before the event started. So it was basically letting us know what was going to be his speech. I have a few questions for him, but we invited him to be at our podcast for a full episode when we gonna be asking some questions. And if you have questions for Dr. Eric Westman, this is a good moment for you to leave your comments below and tell me what would you like me to ask him next time when we invite him to the channel. So for not further ado, here is Dr. Eric Westman with us at Express Soul Health and Wellness Podcast. Here is Dr. Eric Westman. Thank you. So, Dr. Eric Westman, how are you?
I'm great, thank you.
Welcome to the Low Carb for Better Health event. We're happy to have you here. My podcast is very, very happy to be this year sponsoring the event and excited about bringing the message to the masses about the importance of the quality of food and how the ketogenic diets can help them in losing weight and be healthier. You're one of the pioneers, if not the pioneer, in all of this movement of the keto diets, and you have been very active in YouTube and your social media, bringing this message to the people. And still, I can see a lot of confusion in people, even on my podcast, they make comments, what is better? a diet that is low carb and better, more emphasis in healthy fats, or like years ago they say no, you should be in a low fat diet and carbs are okay. What is the truth about it?
Well, thank you for having me on. And I think that there are actually a lot of ways to be healthy. That's why it's confusing.
Okay.
But for most Americans, and we think, or westernized societies, about 2/3 of people will probably do better on low carb diets, not low fat diets. And that's a big change. I mean, we were all raised with the low fat idea in mind. We were all taught that eating fat was bad and eating carbs was good, and even sugar. When you had I remember mounds of sugar for Halloween, and I would trade the candies with my brothers, and so as a result, we now have the biggest diabetes and obesity epidemic ever before, and it's all about the food. And it's interesting. It's not the plastic in the bottles, and not that that's not important, but it's the food. It's not really that we become more sedentary and not everyone's at the gym. It's the food.
The food is a big problem.
Yeah.
So in your opinion, if we know today that the food is mainly the contributor to the state of health, what are, in your opinion, the 3 top most unhealthy foods out there in general for a human?
Well, I would start with what you shouldn't have. Does that count?
Yes, it counts. You shouldn't have the following.
Shouldn't have simple sugars.
Okay.
So no drinks that have sugar in it, or not much. So in fact, I came over on a plane today. The person sitting next to me, she probably weighed 400 pounds.
Oh my.
I do this. I'm a weight loss doctor, obesity medicine doctor in a clinic. In fact, I came from clinic today over at Duke. And so I kind of know how much someone weighs, and whether I need the big tape measure or the small one. And I asked for a coffee, black, and she had juice.
Oh, full of sugar, my goodness.
The message has not gotten out. The sugar turns to fat. And so my first thing is don't have sugar. Don't have sugar in the drinks.
Okay, on the drinks and on the food in general, because sugars are hidden in so many places.
Yeah.
I mean, even foods that we don't believe they have sugars hidden. Now, what about the artificial sugars?
Well, I think in the short run, they're fine. So actually, I use them. I know this is quite controversial on the internet. I don't try to get the perfect diet first. I teach a pragmatic, practical diet first. And so I use the non-sugar sweeteners. Some of them are artificial, some are natural, but they're not sugar, to get people off of sugar. And then I teach people that, you really don't need those in the long run. But it would be very difficult for me, for example, to get that person sitting next to me who's drinking sugar all day long to immediately stop all sweet things.
I agree with you.
So that's a compromise that I'm willing to make. But back to your original question, I think protein in any form that's natural, animal source protein, is the best food. It could be meat, red meat. It could be poultry, white meat or pork. It could be fish. It could be eggs. So I put all of those together as the healthiest foods.
Okay, what other food you shouldn't have?
Well, so then that's where we get into the really starchy foods. So if you know that sugar raises the blood sugar, raises the insulin, and that's what makes you gain weight and have diabetes, it's natural to cut out sugar in the drinks. But it's starches, really starchy foods that get digested to sugar, that are kind of the sleepers. So it's the potatoes, the French fries, the cottage fries, the pasta, the rice, and the fruit. And in North Carolina, where I work, it's like one fruit after the other, and it's like whack-a-mole. That game at the county fair where strawberry season, Doc. Well, I know it's fruit. Well, it's peach See, no, and now it's muscadine grape seed.
They're very sweet. Yeah.
So I do use the non-sugar fruit flavored things to help people stay away from the fruit itself. But yeah, that would be the fruit pasta. So the starchy foods get digested to sugar, and once people understand that, it's helpful.
Perfect. Now we're talking about healthy fats. What is the difference between healthy fats and bad fats that are for you, or bad oils that are for you?
So here's where I kind of really retrench back to what we know scientifically. I think any animal fat is fine. So saturated fat, something we were taught to fear, oh, it's terrible, is fine. In fact, things like the oils, like olive oil, palm oil, these are fine. And now on the program that I teach, because you have so little processed foods, you don't get much vegetable oils or seed oils.
Oh, no.
You don't get it? Well, but so I don't have to teach to avoid that. And there's a big distraction, I think, on the internet of people thinking they have to be so careful to not have any of that. I think if you limit it to a small amount, the seed and vegetable oils, you're not going to get it. You can be healthy. So this means you can have access to the fast foods, the processed foods that are in our environment now, and that makes this approach accessible to more people. So, I teach this in many ways. If you wanted to have super clean organic food, go to the farmer's market, great. But most of my patients in Durham, North Carolina, they can't afford that. They can't do that. So I can teach someone, if they're eating at McDonald's, how to do this. Now, it might not be the healthiest diet on earth, but I have to get people off the
in
sugar.
a transition. And you're absolutely right, because what I found in talking to many doctors or health practitioners, such as Amanda Decker, the organizer of this event, on what is the key of success on having someone to stick to a program. And I think you mentioned something that is key here. It is not having this change immediately, like from what you're doing to totally not doing that at once, because it is a lot of in the mindset that has to be like a transition, as you mentioned here, bringing someone from the bad habits to the good habits in a progressive way. In that way, it will be more sustainable.
So, but it's different for different people.
Absolutely.
Some people can come in and just cut out all the carbs or most of them and do great. Others have more of it. I think it is kind of an emotional attachment to food, but that can be broken pretty quickly. And once you understand that you can reverse the diabetes that you've had for 10 years. I was talking to someone today. She didn't know. She was a nurse. She didn't know that she could reverse type 2 diabetes.
Oh my God.
So the awareness, even in the medical world, is very
not
very
there.
low. No.
And I can say that, Dr. Westman, because I do talk to a lot of people, regular people. I'm a civil engineer, a professional engineer. I understand data.
Well, so you think things are orderly and...
But I understand data. When I see the stats, and I see that our spending, that is almost $5 trillion in healthcare alone every year, 80% of that spending goes to inflammatory diseases and chronic disease. I can see that we're doing something wrong at the macro, and you are absolutely right. The word still is not out there, not even in the medical field. So what we should do to improve those stats and make the people more willing to make changes that are beneficial for their health?
Well, so I started with learning about a low carb diet, an Atkins type diet, over 25 years ago. Yeah, 25 years ago, I went to visit Dr. Atkins and all the other doctors who were using this. And then, so our kind of claim to fame is that we started researching and publishing papers on it. So I didn't make this up, and even Dr. Atkins didn't make it up. He borrowed a book called The Banting Diet that was used in London, England in the 1860s, and then Banting kind of looked at the hunter-gatherer ancestral way of eating, and so none of this is new, really. What's new is all the crappy foods. And so, but in our lives even, especially in our children's lives, all they've known is fake foods. And the industry is making food that is irresistible. And so we got to get to that. Right now, I can help someone who's very sick reverse their health problems. It's hard work. I mean, it takes a lot of time from a doctor to help someone get off medicines. It's well worth it. But it would be better use of our time if we could stop people from starting.
Yes, absolutely.
In childhood and in schools to teach that, what you eat really matters. And how silly is that we have to say that, But so I'm in a clinic, and I kind of stay in my lane, learning about how to help people who are ill. I've treated very sick people and helped them get better. And so that's, I want to give hope to people who are sick. But then the big picture view is we need to stop that consumption of food, junk foods, the sugar and ultra-processed foods earlier in people's lives.
I think that the awareness is very important of the adults and let them know that what is not good for them is not good for the children. Because they may say, oh, no, I don't want to eat carbs, they're not good for me. But I have to go and make dinner for my kids. I'm making macaroni and cheese. So it doesn't make sense. They may think
they don't have to have macaroni.
So a healthy adult should educate a healthy kid. It will translate those learning experiences on what is better food for them to the children. So we have healthier families.
But so most doctors have no training in nutrition. Most medical schools have no, and that's important for people to know. Doctors are not trained in nutrition. And so what I would like people to know is that real food is best, not fake food, not food in a box, in a bag, things like that. And macaroni or macaroni and cheese comes in a box, in a bag.
Yes.
So that's not a healthy thing to have. And then the main thing is to stay away from large amounts of that. And it's confusing because some people can handle the carbs better than others.
Yes.
So if you're younger, you're more active, you don't have obesity gene in your family, you can eat more carbs. And even in one family, I have a brother who was able to eat carbs all of his life until he got to a certain age.
It catches up. It catches up, yeah.
But so that's why it's complicated, but it's really not that complicated. It's really getting rid of the junk foods.
Over-processed food, yeah.
And that's the safe language. I find other doctors get upset if you bring in the Atkins, even keto. People will go, oh, you can't, and then carnivore, oh no, don't do that. But if you say, I'm just not having sugar in ultra-processed food, they go, oh, that's good. Or you say...
It's an elimination diet. What you're not getting into your mouth is
or if you say you're getting the Mediterranean diet,
yes.
The Mediterranean diet, suddenly the doctor goes, oh, well, that's healthy. And then since they don't know what it is, they don't ask you what you eat. So anyway, I'm kind of on I'll say, has a doctor ever asked you what you eat
Never.
and drink? I mean,
Never.
Like, have you write it out, like I just did? Because I asked people to write all that out, and they'll go, no. So doctors are trained in medications, not nutrition.
Not prevention.
Not prevention.
So
either.
when I see, back to the stats that I love to see the numbers and see where the trends are. And when I see this large spending into the healthcare in America alone, over $4 trillion, almost $5 a year, and I see we rank so low into the world, other countries in the overall health of the population, I see that the return of the investment is not there.
Yeah. So the harsh reality is that among people who are in poverty, there's more obesity than underweight. So the major health issue that has to do with nutrition is overnutrition. If you're getting the wrong food.
I know.
And I saw that in my own area where my children went to a school where it was an inner city population. Mm-hmm. They got sugary cereal at home. They were hungry because they didn't have any protein in the morning, the children.
Society,
so they give them pancakes and syrup.
They have to eat more.
So they eat more and more. And then at lunch they have these they call them little Debbie cakes or ho-hos and little snacks. And so they're eating sugar all day long. I met a young man who weighed 700 pounds in
That-
his early 20s.
Wow.
So it's sugar that turns to fat. We don't store sugar in our body.
No.
We store fats.
So, Dr. Weissman, tomorrow, what is going to be your talk about?
Well, thank you. I have to talk a little about the background of the science.
Okay.
Science is what this is based in now. I mean, this is as solid as the science that allows a civil engineer to build a dam.
Yes.
Right? You know?
Yes.
The problem is the body adapts and maybe doesn't last as long as a dam.
Got it.
But the science is there, and then I'm going to give some practical pointers on how to navigate the world of carbs around there. And then I will talk a little bit about something called upstream medicine, where you want to start with prevention.
Beautiful.
Don't wait till people are in the
No. Prevention is always better. So for my listeners out there, stay tuned because we're going to be showing a little bit of that talk with Dr. Weissman. And again, if you didn't know about this event this year, I want you to look at the material that we're gonna be posting in my podcast. And I invited you to my podcast, Dr. Weissman, to have a session one-on-one. We have all of these questions from our listeners and have a very informative podcast in the near future. So thank you very much, and we're looking forward to hear your talk tomorrow at the Low Carb for Better Health. Thank you.
Thank you.
If you like the content of our conversation with Dr. Eric Weissman, please leave your comments below. We want to hear from you. And remember to leave your questions. Next time we have him in our podcast, I'll make sure to ask those questions for you. And also, remember to support our channel by supporting our Expressol coffee. Expressol coffee is my brand of coffee. And I created this brand with your health in mind. All my coffees are low acidic. We work with small farmers in Central and South America. This one is Alma. Alma means soul. And this is a beautiful coffee, gourmet specialty beans coffee from Colombia, my country of origin. Sana is our blend of organic coffee. And Activate is our house blend. And this one had a little bit more of a punch if you need extra energy. All our coffees are low in acidic because we roast them to perfection. We want you to have the most delicious coffee, healthy because you won't hurt your stomach or your teeth, also nutritionist because we know these coffees come from volcanic soils full of rich antioxidants and nutrients and polyphenols that are good for you. So don't settle for less. Bring to your house Expressol coffee. Best healthy coffee available in the market. Go www.expressolcoffee.com. Put the code podcast15 for 15% off of your entire purchase. Plus, shipping is free after $50 purchase. You buy 3 bags of my coffees and you have free shipping plus the discount of the 15% off. It's a great deal. Go get it. www.expressolcoffee.com. And remember, my friends, until next time, health is wealth for the body, mind, and soul. Take care.
Thank you very much for listening. And if you like the information that we shared with you today, please subscribe to the Express Soul Health and Wellness podcast and follow us in the social media outlets of your choice. Until next time, please remember, health is wealth for the body, mind, and soul.